Immunosuppression induced after a solid organ transplant drastically increases a patient's risk for development of cutaneous squamous cell carcinoma. In the general population, cumulative sun exposure is the most significant risk factor for the development of cutaneous SCC. Vasovagal syncope is associated with diaphoresis, lightheadedness, nausea, sweating, visual alterations, and pallor, usually triggered by an emotional situation, characterized by a rapid recovery of consciousness and cognition, unlike seizures in which patients present with a post-ictal state. Guillain-Barré is an autoimmune polyneuropathy that presents as an acute onset of ascending paralysis with areflexia. It may be preceded by an infection that has been associated with HIV and Campylobacter. CSF analysis shows high total protein levels with normal white blood cell count, called albuminocytologic dissociation. Night terrors are characterized by the child suddenly crying out, sitting up in bed with a terrified look, crying inconsolably, perhaps thrashing about and exhibiting evidence of increased autonomic arousal, with enlarged pupils, tachycardia, rapid breathing, and sweating. Night terrors are most common in children aged 2 to 6 and typically occurs within the first several hours of sleep. Evidence of group A strep is an absolute requirement for diagnosis of rheumatic fever. It can be a positive culture, elevated or rising titers of anti-streptolysin O, anti-DNase B, or anti-hyaluronidase. Anti-DNase B titers are indicative of group A beta hemolytic strep infection within the past 2 to 4 weeks and are the most sensitive and specific of the serologic markers. Dequervain's tenosynovitis is caused by inflammation of the tendon of the abductor pollicis longus and the extensor pollicis brevis in the first dorsal extensor compartment of the wrist. It may accompany pregnancy, repetitive use, or trauma. The Finkelstein test, which can be carried out by passively flexing the patient's wrist in the ulnar direction while having the patient grasp the thumb within the palm of the hand, typically reproduces the pain in this condition. Pain can also be reproduced with assistance to thumb extension and abduction. In a patient highly suspicious of having infective endocarditis, best next step is to draw blood cultures followed by intravenous empiric antibiotics. Most common cause of diastolic heart dysfunction is chronic hypertension resulting in concentric hypertrophy. Most effective first-line management is a beta blocker. Beta blockers act by both reducing blood pressure and decreasing heart rate to allow for improved ventricular filling. Most common lipid abnormalities in metabolic syndrome include metabolic syndrome, insulin resistance, obesity, increased abdominal circumference, hypertension, and lipid abnormalities including serum triglycerides greater than or equal to 150, serum HDL cholesterol lower than 40 in men, and less than 50 in women. Patients with renal artery Artery stenosis depends on vasoconstriction of the efferent arteriole to maintain GFR. However, ACE inhibitors abolish the vasomotor tone and the efferent arteriole, resulting in worsening renal function. Renal function improves with the removal of ACE inhibitors. This effect is seen only in bilateral renal artery stenosis or unilateral stenosis in a single functioning kidney. In unilateral renal artery stenosis, the unstenosed kidney provides enough GFR so that the GFR does not rely on the vasoconstriction of the efferent arterioles. ACE inhibitors are the drugs of choice in unilateral renal artery stenosis. Focal segmental glomerulosclerosis presents with nephrotic syndrome and may occur as primary or secondary forms. Though the primary form is mostly idiopathic, secondary form is seen in patients who have a history of HIV/AIDS, obesity, sickle cell, or hematologic malignancies, or in IV drug users. Diagnosis is confirmed on renal biopsy, which reveals segmental sclerosis on light microscopy. Both emphysema and chronic bronchitis are manifestations of COPD. The way to differentiate the two diseases by pulmonary function test is to look at the DLCO, which is normal in chronic bronchitis, and decreased in emphysema. Emphysema is a disease destruction of the alveoli. Chronic bronchitis is a disease of airway inflammation and bronchoconstriction. In emphysema, there will be destruction of the pulmonary capillaries surrounding the alveoli, and this will lead to decreased diffusion of oxygen. There is also an increase in VQ mismatch. You will have overventilation with decreased perfusion. As the capillaries get destroyed, there will be an AA gradient. Findings specific for Graves' disease include ophthalmopathy, exophthalmos, proptosis, periorbital edema, and pretibial myxedema. Other findings such as lid lag and stare, heat intolerance, tachycardia, hypertension, and hair thinning are non-specific in hyperthyroidism. HIV myelopathy is a diagnosis of exclusion. Histologically, it presents with microscopic vacuolysis of the posterior and lateral columns. Has a similar presentation to peripheral neuropathy due to B12 deficiency. Essential features of the disorganized type of schizophrenia are disorganized speech, disorganized behavior, flat or inappropriate affect. Disorganized speech can be replies that are unrelated or only obliquely related to the questions posed, or a speech pattern with no trend or thought content. Behavioral disorganization include lack of goal orientation and difficulty performing activities of daily living. Associated features can include grimacing, mannerisms, and other oddities of behavior. This subtype is usually associated with poor premorbid personality, early insidious onset, and poor prognosis. CMV retinitis occurs in immunocompromised patients and is commonly associated with AIDS. Diagnosed by symptoms of sudden and progressive loss of vision. Low CD4 count and fundoscopic exam that shows retinal spots and flame hemorrhages. Condyloma acuminata caused by HPV strain 6 and 11 can present as large exophytic cauliflower-like masses. The typical cauliflower-like appearance of the lesions help to differentiate them from the hemorrhoids and other non-hemorrhoidal causes of perianal masses. Risk factors for infection with HPV and the development of warts include sexual activity and HIV. Treatment is freezing, trichloroacetic acid, or surgical removal. Hypoxia and deterioration in an intubated patient may be caused by airway obstruction, pneumothorax, progressive pneumonia, or other causes. Airway obstruction should be suspected with a decline of oxygen saturation and complete whiteout of the lung, along with poor air entry and dullness to percussion. Airway obstruction of any kind is managed with flexible or rigid bronchoscopy to remove the obstructing object. Primary polycythemia should be suspected with the following. Symptoms: flushing and itching, especially after a hot shower, fatigue, dizziness. Signs: splenomegaly, increased hematocrit hemoglobin, thrombocytosis, decreased serum erythropoietin, and increased leukocyte alkaline phosphatase. Cervical insufficiency describes a presumed intrinsic weakness in the cervical tissue that contributes to pregnancy loss, usually in the second trimester, or otherwise normal pregnancies. Prevention of cervical insufficiency can be accomplished to some degree with cerclage and/or supplemental progesterone, IM or vaginal. Screening for signs and symptoms of cervical insufficiency in patients who have a history of second trimester loss includes cervical exam and cervical lengths measured with ultrasound. Isolated elevation of alk phos level could be caused by bone, liver, intestine, or placental tissue. A glutamyl transpeptidase, GGT, or 5' nucleotidase test is the next step in diagnosis. If GGT level is found to be high, the alk phos is coming from the liver. A right upper quadrant ultrasound should be done next. If GGT is found to be low, the alk phos is coming from the bones. Bony condition that cause increased turnover, like Paget's, should be suspected. Medical therapy for hepatitis C is with pegylated interferon and ribavirin. It is indicated for individuals who have measurable HCV titers and a liver biopsy specimen showing portal or bridging fibrosis with at least moderate inflammation and necrosis. Patients who develop advanced liver disease should be treated with this regimen and evaluated for liver transplantation with a liver biopsy. Variceal hemorrhage, ascites, and encephalopathy are manifestations of decompensated cirrhosis. Asymptomatic aortic stenosis is initially treated with afterload reducers such as ACE inhibitors when blood pressure control is needed. Aortic valve replacement is indicated when the valve area is less than 1 centimeter, or pressure gradient across the valve is greater than 50 millimeters of mercury. Hypospadias is a condition in which the urethral opening is ectopically located on the ventrum of the penis, proximal to the tip of the glans penis. Circumcision should be delayed because the prepuce will be needed for the plastic reconstruction, which can be done after 6 months of age when the infant can better tolerate anesthesia. Mild to moderate dehydration can be treated at home with oral rehydration and encouragement toward a regular diet. Severe dehydration requires hospitalization with IV fluids. Non-proliferative retinopathy is characterized by dilation of veins, microaneurysms, retinal edema, and retinal hemorrhage. On fundoscopic exam, hard exudates and cotton wool spots are classic findings. Proliferative retinopathy, a more advanced form of disease, results in neovascularization. Skin prick testing or immunoassay testing is most helpful in confirming suspected allergens for a definitive diagnosis to be made in IgE-mediated allergies only. Food challenge testing is reserved for cases in which the diagnosis or suspected allergen is unclear and previous tests have been equivocal. Low-risk patients with a pulmonary nodule and a benign appearance should be followed up with serial CT scans every 3 months for 2 years. Benign appearing lesions include those with coarse, popcorn-like diffuse, central, laminar, and concentric classifications. If the patient has a lesion that is non-calcified, has stippled or eccentric calcification, is its size greater than 4 centimeters, or has increased in size compared with previous X-ray, then excision of the lesion and CT scan of the chest would be necessary. Needle biopsy is used for patients with intermediate risk. However, the patient is classified as low risk because of the small size of the lesion. Intermediate risk patients with lesions greater than 1 cm should be investigated with PET scans or biopsies.